Eric Holtgrefe enjoys the outdoors and everything life has to offer with his wife and children. Hours from St. Louis, Eric manages a ranch they own in Alton, Missouri, and he's the author of science fiction novels. Looking at how fit Eric appears now, it may be hard to believe Eric's recent harrowing medical journey as a new heart failure patient.
I was air evac'd by helicopter because it's a rural area. They were like, we need to get you to a hospital stat.
In and out of hospitals, different doctors, eventually leading him down the path to Mercy Heart and Vascular Hospital, St. Louis.
The very first cardiologist I met in the heart hospital was Dr. Davis.
Good morning. The heart muscle itself was very weak, so he was having a hard time pumping blood. The aortic valve that he had wound up having replaced was very calcified, very thick, not opening well.
Within almost a week, I had a new valve. I had a transaortic valve replacement.
The procedure happened only weeks before this follow-up visit with Mercy cardiologist Dr. Jonathan Davis.
You look so much better than you did before.
Eric says he knew from a young age his heart is vulnerable.
I'm a 33-year cancer survivor. I went through Hodgkin's lymphoma as a 17-year-old child, and at that point in time, I was given full mantle radiation. Get radiation or die, and so I'm like, well, I choose radiation. And I'm like, when I'm old, I'll deal with this. And I didn't realize at 50, I would be old.
He had a lot of radiation to his chest. How does that involve the surgical risk? Because the radiation actually makes it more complicated. So what looks like a simple thing on the surface actually turns into a big conversation with all these different specialties coming together to have a conversation about how we can best take care of the person in front of us. In this case, get Eric his TAVR to not have to do open heart surgery. Yes, maybe in 20 years from now he needs another valve, but he's alive that next 20 years.
With the complexities of Eric's case, he's now part of Mercy's new heart failure program.
The whole patient in their approach to care. Heart failure is any problem of your heart getting blood into it or getting blood out of it. So it can be a problem with the heart pump filling with blood and then pumping it out, or the heart pump itself being too weak to pump blood to the body and meet all of the needs that the body has. So when we think about heart failure specifically, there's a team of medications that might need blood pressure monitoring or heart rate monitoring or lab monitoring. It takes an army, it takes a village to be able to get patients these medications, make sure the insurance goes through, they get to the pharmacy, they know what to take, because it's a lot of stuff. We have that team in a really robust, thoughtful, multidisciplinary way.
And Eric is thriving in the program.
Phenomenal. He is now engaged in cardiac rehab.
Electrodes hooked up to me and they watch me run on a treadmill, which, I can't quite enjoy that.
So you have a nurse who can act like a personal trainer, gets you on the bike or the treadmill and monitors your heart rhythm, your heart rate to make sure you can exercise in a safe way. And he is now doing great. And he is someone who could barely walk across the room. He is now getting on the treadmill at 3 miles per hour with 1% incline for half an hour. And he's excited because he's graduating to 2% incline at 3 miles per hour for 30 minutes. And so that is 3 miles per hour. That's a brisk pace. So he is doing fantastic.
For Eric and his family, Mercy's heart failure program is offering a new path in life, which takes great strength.
It's best to be near a hospital like Mercy Heart Hospital here in St. Louis. And so, yeah, we're in the process of moving. The care that I'll be getting is going to be a lifetime thing. I'd like to stay close to here. So many minutes to be able to get to major medical care so that they can treat whatever's happening.
The journey is inspiring this science fiction writer to write a nonfiction novel.
Mini autobiography called Mercy of the Heart. That's just a working title.
Perhaps a good name for a good reason.
I can tell you, no one's going to do it better than us.